In this article, we will talk about what is implantation bleeding, when does implantation bleeding happen, implantation bleeding symptoms, how long does implantation bleeding last, implantation bleeding treatment, other causes of bleeding during pregnancy, when to see a doctor. What is implantation bleeding? Implantation bleeding is defined as a small amount of light spotting or bleeding that occurs about 10 to 14 days after conception. How does implantation bleeding occur? The ovary releases an egg into the fallopian tube. This egg unites with the sperm cell and it is fertilized. The fertilized egg goes on to form a blastocyst. The blastocyst burrows into the wall of the uterus or womb. You have to remember that implantation is the process of burrowing into the uterine wall. The uterine wall contains numerous tiny vessels. Rupture of some vessels occurs during the process of burrowing. This leads to bleeding or spotting. This bleeding is referred to as implantation bleeding or spotting. How heavy is implantation bleeding? Implantation bleeding is a normal occurrence. Some women may not know when it occurs. They become aware when changing their pad or pants. In some cases, the women experience a mild degree of abdominal pain. The blood lost during implantation bleeding is minimal in most cases. The color of the blood seen during implantation is pinkish red. Implantation bleeding symptoms. Implantation bleeding tends to happen before you notice morning sickness. You might have blood that's brown or pinkish, blood that's lighter in flow and doesn't last as long as your period. Mild or no cramping. Unlike your period, you won't see any blood clots or tissue in the blood. It's probably implantation bleeding if you have some of the other signs of early pregnancy, including tender, swollen breasts or nipples, fatigue, headache, upset stomach, vomiting, food cravings or aversions, mood swings, peeing more than usual. If you're not sure whether you're having implantation bleeding or your period, take a pregnancy test or talk to your doctor. How long does implantation bleeding last? Unlike most periods, it usually stops after 1 or 2 days. Implantation bleeding treatment. It will stop on its own. If you're worried that you've bled a lot, call your doctor. They may want to know how much blood you saw and what color it was. Other causes of bleeding during pregnancy. Many things can cause bleeding in pregnant women, some of them harmless and some serious. If you're bleeding a lot, with or without pain or cramping at any time, call your doctor. Continue reading about frequently asked questions on implantation bleeding. Visit moxiever.com now. Remember to like and subscribe to this channel for more health tips.